On a chilly November morning in 2016, George Michael woke up feeling utterly exhausted. This wasn't the usual fatigue after long tours or a hectic schedule. George found himself unable to get out of bed, his body weighed down by an inexplicable exhaustion. After weeks of trying to push through, he finally decided to see a doctor. At the hospital, after several tests and thorough examinations, the doctors delivered shocking news: George Michael was suffering from severe kidney failure. George Michael's kidney issues were not a sudden development. Over the years, he had faced numerous health problems, including a severe bout of pneumonia in 2011, which led to the use of strong antibiotics and anti-inflammatory medications, drugs that can damage the kidneys if used long-term. Additionally, George had been on various medications to address psychological challenges and the pressures of life, which gradually worsened his kidney function without him realizing it. The warning signs of George Michael's kidney failure had been present for some time but were overlooked. One of the earliest signs was prolonged fatigue, a feeling of exhaustion despite adequate rest. When the kidneys begin to lose their ability to filter waste from the blood, toxins build up in the body, causing unexplained fatigue. George often canceled meetings and stayed away from the spotlight due to this feeling, but he thought it was just work-related stress. In addition, George experienced swelling in his legs and ankles. This occurs when the kidneys can no longer remove excess water and salt, leading to fluid retention in the body. The marks left by his socks lingered longer than usual, and his shoes became tighter, yet these signs were dismissed. Another symptom George encountered was the smell of ammonia on his breath and a metallic taste in his mouth. This is a common symptom of kidney failure, caused by the buildup of waste products like urea in the blood. It gave his breath an unpleasant odor and made food taste less appealing. George even experienced unintended weight loss but attributed it to stress and a busy schedule. It wasn't until more severe symptoms appeared, such as blood in his urine and pain in his lower back, that George realized the seriousness of his condition. By then, his kidney disease had progressed to an advanced stage, and his kidney function was beyond recovery, leading to his passing shortly afterward. This reality highlights that recognizing the signs of kidney failure is not difficult if we pay attention. Before fatigue becomes overwhelming and irreversible, our bodies give us multiple warnings. So, what are these early warning signs? In today's video, we'll explore 10 early warning signs of kidney failure. But before we begin, don't forget to like, subscribe, and hit the notification bell to stay updated with daily health tips. 1. Changes in urine. The kidneys are responsible for filtering the blood and removing waste, so any changes in your urine can be an important warning sign. If you wake up one morning, go to the bathroom, and notice that your urine has foam, changes in color, or an abnormal amount, be cautious. These could be signs of kidney failure. Foamy urine. If your urine is foamy, similar to beer foam, this could indicate that your kidneys are leaking protein into the urine, a condition called proteinuria. Protein is something that should be retained in the body, and when it escapes through the urine, it means your kidneys are not functioning properly. Changes in urine volume. If you suddenly urinate less or more than usual, this could suggest that your kidneys are having trouble filtering the blood and concentrating urine. Weak kidneys can cause you to urinate less, but they may also make you urinate more, especially at night. Dark or bloody urine. Brown, dark red, tea-colored, or Coca-Cola-colored urine may indicate kidney damage or issues in the urinary tract. If you notice any of these signs, see a doctor immediately. Have you noticed any changes in your urine recently? If so, don't ignore these signs, as they may warn that your kidney function is compromised. 2. High blood pressure. The second sign is a sudden increase in blood pressure. The kidneys not only filter blood but also play an important role in regulating blood pressure. They balance sodium, salt, and water in the body. As the kidneys filter blood, they remove excess sodium and water through urine, helping maintain stable blood pressure. Additionally, the kidneys produce hormones like renin, which help regulate blood vessel constriction and blood flow. When kidney function declines, the kidneys can no longer remove enough excess water and salt. This causes sodium and water to build up in the blood, increasing pressure in the blood vessels. In response, the blood vessels constrict to control blood flow, but this only increases pressure on the vessel walls, leading to high blood pressure. Moreover, when the kidneys are weakened, their production of the hormone renin may become disrupted. Renin regulates blood pressure by causing blood vessels to constrict and retaining water, but when the kidneys are damaged, renin may be produced excessively or insufficiently, resulting in poor blood pressure control. When high blood pressure leads to increased blood pressure, the blood vessels in the kidneys become damaged. This reduces the kidney's ability to filter blood and remove waste, further weakening the kidneys. The more kidney function declines, the harder it becomes for the kidneys to regulate blood pressure, creating a dangerous cycle. However, high blood pressure doesn't always indicate kidney failure. You can rely on the following signs to determine if high blood pressure is related to kidney problems. Sudden or difficult to control blood pressure. If you don't have a history of high blood pressure but suddenly experience an increase without a clear cause, or if you've been treating high blood pressure but it's still unstable, this could be a sign of kidney failure. Persistent high blood pressure despite medication. If you're taking medication for high blood pressure but still can't control it, your kidneys may be at fault. Blood and urine tests to check kidney function are essential in these cases. Other symptoms of kidney failure. If high blood pressure is accompanied by other signs such as fatigue, swelling, or changes in urine, these are clear warnings of possible kidney failure. If high blood pressure remains uncontrolled for an extended period, it can severely damage the blood vessels in the kidneys, reducing their ability to filter blood. This condition not only increases the risk of chronic kidney failure but can also lead to end-stage renal disease, requiring dialysis or a kidney transplant. High blood pressure can also lead to serious complications such as heart failure, stroke, and damage to blood vessels in other organs like the eyes and brain. So, be sure to monitor and regularly check your blood pressure. 3. Fatigue and weakness. The third sign is fatigue and weakness. This is one of the most common yet easily overlooked symptoms of kidney failure. Have you ever felt exhausted without a clear reason, even after getting plenty of rest? This could be a sign of anemia, a condition common in people with chronic kidney disease. Our kidneys not only filter the blood but also produce the hormone erythropoietin, which stimulates the bone marrow to produce red blood cells. When kidney function declines, the body loses its ability to produce enough erythropoietin, leading to a lack of red blood cells and, consequently, less oxygen in the body. As a result, you may feel tired, weak, and even dizzy. Anemia and kidney failure not only drains your energy but also significantly impacts your ability to carry out everyday tasks. You may feel exhausted as soon as you wake up in the morning, even after a full night's sleep, and even simple activities like walking, climbing stairs, or standing for long periods can become tiring. Many people describe a feeling of brain fog, making it hard to focus and reducing their productivity. The lack of oxygen not only affects your muscles but also impairs brain function, leading to concentration difficulties and memory problems. Additionally, anemia can cause dizziness or lightheadedness, especially when you stand up suddenly, a phenomenon that occurs when blood pressure is insufficient to supply the vital organs. These symptoms are often mistaken for other causes, such as stress, lack of sleep, or a busy lifestyle, causing many people to overlook the fact that their kidneys may be struggling. If you frequently feel unexplained fatigue, it may be time to see a doctor to check your kidney function. 4. Swelling, edema. Swelling, also known as edema, is a common and visible sign of kidney failure. When the kidneys are no longer functioning properly, they cannot remove excess water and salt from the body, leading to fluid buildup in the tissues. This often causes swelling, particularly in areas such as the legs, ankles, and around the eyes. You might notice that your shoes suddenly feel tighter, or that marks from your socks remain on your skin for an extended period. This is a sign that your body is retaining excess water and salt, a direct consequence of kidney failure. If this persists without a clear cause, it may indicate that your kidneys are having problems. Swelling around the eyes, especially in the morning, is also a warning sign of kidney failure. When fluid accumulates in the tissues around the eyes, it can cause puffiness, making the face look tired and drained. Many kidney patients overlook this symptom, thinking it's just a sign of fatigue or lack of sleep, but when combined with other symptoms like fatigue, reduced urine output, or foamy urine, it could be a clear warning that kidney function is declining. The cause of swelling in kidney failure is not just fluid and salt retention. When the kidneys weaken, they also lose the ability to retain essential proteins in the blood. Through the urine, protein leaks out, reducing the blood's osmotic pressure, which causes water to seep into the tissues, leading to swelling. This is not just an uncomfortable symptom but a sign that the kidneys are severely damaged and need prompt treatment. Swelling is an important sign because if left untreated, it can lead to serious complications like heart failure, as too much water buildup puts pressure on the heart, or permanent kidney damage. This can result in end-stage kidney disease, requiring dialysis or a kidney transplant. 5. Persistent itching. Persistent itching is a lesser-known but significant warning sign of kidney failure. When the kidneys lose their ability to effectively filter waste and toxins from the blood, these substances can accumulate in the body, leading to serious issues, including itching. This symptom is common among people with kidney failure and is a sign that the condition may be worsening. The primary cause of itching in kidney failure is the buildup of waste products such as urea and other chemicals in the blood. Normally, the kidneys filter these substances and expel them through urine, but when kidney function declines, this process is disrupted. The accumulation of urea and toxins not only affects internal organs but also has a direct impact on the skin, causing it to become dry and itchy. Additionally, kidney failure can lead to imbalances in minerals, particularly calcium and phosphorus. When these levels rise, they can irritate the skin, causing persistent, uncontrollable itching. Persistent itching due to kidney failure can severely affect a person's quality of life. Some patients describe feeling itchy all over, not confined to a specific area, and the itch is constant and difficult to relieve. This doesn't just cause discomfort, it can also disrupt sleep. The itch often becomes more intense at night, leading to insomnia, fatigue, and a decline in mental health. Patients may scratch excessively, leading to skin damage, infections, and darkened skin, impacting their appearance. If you notice persistent itching without a clear cause and it lasts for an extended period, do not ignore it. This could be a sign that toxins are building up in your body due to kidney failure. 6. Metallic taste in the mouth and ammonia breath. If you experience a metallic taste in your mouth, as if you've been sucking on a coin, or notice that your breath has a strong, Unpleasant smell, similar to ammonia or urine. This could be a significant warning sign of kidney failure. When the kidneys aren't functioning properly, waste products like urea and nitrogen build up in the blood, affecting both your taste and breath. This is not only uncomfortable but also a clear sign that your kidneys are in trouble. The cause of this is the buildup of waste in the blood, particularly urea. The kidneys play a crucial role in removing these waste products from the body through urine, but when they fail to function correctly, substances like ammonia start to be released through the breath. This phenomenon, known as uremic breath, causes the bad odor and a metallic taste in the mouth. This condition affects more than just taste. The unpleasant metallic taste often reduces appetite, causing patients to eat less and potentially leading to unwanted weight loss. Food becomes harder to swallow and less enjoyable, reducing the overall quality of life for the patient. If you experience these symptoms, they are serious warnings about kidney function, and immediate medical attention is required to prevent further complications. 7. Pain or discomfort in the lower back. Lower back pain or discomfort near the ribs can be the third significant warning sign that your kidneys are sending, especially when the pain is persistent or accompanied by symptoms such as difficulty urinating or blood in the urine. The cause of back pain and kidney failure often stems from issues like infections or kidney stones. When the kidneys are inflamed or infected, sharp pain can occur in the lower back or hips. For those with kidney stones, the pain is usually more severe, radiating to the abdomen and hips, causing greater discomfort. If you experience unexplained lower back pain, especially if it comes with symptoms like blood in the urine or difficulty urinating, do not hesitate, see a doctor immediately. This could be a sign of a serious kidney condition, such as a kidney infection or kidney stones, and timely medical attention is necessary to prevent more serious complications. 8. Anemia and feeling cold. Anemia is one of the most common and serious complications of kidney failure, and it can make your body feel unusually cold. Normally, the kidneys produce a hormone called erythropoietin, which stimulates the bone marrow to produce red blood cells, responsible for transporting oxygen to organs and tissues in the body. However, when kidney function declines, the body can no longer produce enough red blood cells, leading to a lack of oxygen and anemia. The reason behind this cold feeling lies in the reduced number of red blood cells, which diminishes the ability to transport oxygen. When the supply of oxygen to the cells and tissues is inadequate, the body cannot maintain its normal temperature. As a result, you may feel cold, even in a warm environment. This doesn't just affect your body's ability to stay warm but also negatively impacts your overall energy levels. Along with making you feel cold, anemia due to kidney failure is often accompanied by symptoms such as fatigue, weakness, and a lack of vitality. The lack of oxygen reaching important organs like the brain and muscles prevents the body from functioning efficiently, leading to exhaustion even when you're not overexerting yourself. Some people may also experience dizziness or lightheadedness due to insufficient oxygen reaching the brain, which can impair concentration and hinder daily activities. 9. Shortness of breath or feeling of suffocation. Shortness of breath or a feeling of suffocation is a dangerous sign that kidney failure may have advanced. When the kidneys can no longer remove excess fluid from the body, this fluid can accumulate in the lungs, causing pulmonary edema. This restricts the exchange of oxygen, making it difficult for the person to breathe or take deep breaths. Some patients describe feeling drowned or unable to breathe fully. Shortness of breath and kidney failure is often accompanied by symptoms like swelling in the legs, ankles, or feet, as fluid also accumulates in other tissues in the body. If you notice a combination of shortness of breath and swelling, this is a warning sign that kidney function is severely declining, which can affect not only the lungs but also the heart. The primary cause of this condition is excessive fluid buildup in the body, which not only causes pulmonary edema but also puts pressure on the heart, increasing the risk of heart failure. When both critical organs, the kidneys and heart, are affected, the disease progresses faster, creating a dangerous cycle. If shortness of breath appears suddenly or worsens over time, this could indicate end-stage kidney failure or heart failure, requiring immediate medical intervention. 10. Persistent itching. One day, you might start to feel persistent itching on your skin without any apparent reason. Initially, you may think it's due to allergies or dry skin, but the itch continues, even after using moisturizers or topical creams. Despite your best efforts not to scratch, you eventually can't resist and begin to scratch vigorously, causing skin damage and even bleeding. This not only causes discomfort but also affects your sleep and daily life. This could be a sign of a more serious issue you hadn't considered: kidney failure. When the kidneys are no longer functioning properly, they can't remove all the harmful toxins from the blood. These substances, including urea and other waste compounds, start to accumulate in the body and may penetrate the skin tissues. The buildup of toxins under the skin leads to persistent itching, especially in people with end-stage kidney disease. This type of itching is different from common allergic itching. It is deeper, more prolonged, and harder to control. The cause of this itching lies in the imbalance of minerals in the body, especially calcium and phosphorus, two substances that the kidneys normally regulate. When the kidneys are weakened, phosphorus levels in the blood rise, leading to deposits of this mineral under the skin, which irritates it. In people with end-stage kidney failure, the itching can become severe, lasting throughout the day and night, greatly impacting their quality of life. Some patients describe the itching as intense, like being bitten by insects or pricked by needles all day long. Persistent itching doesn't just affect physical well-being but also has serious mental health consequences. Dealing with constant itching can increase stress, anxiety, and even lead to insomnia. For many patients, the itch becomes a major burden, especially as it forces them to scratch constantly, leading to severe skin damage. Scratching too hard and frequently not only damages the outer layer of skin but can also lead to skin infections, increasing the risk of other skin diseases, further worsening the patient's condition. This condition is particularly dangerous in patients with end-stage kidney disease when treatments like dialysis can't remove all the harmful toxins from the body. In such cases, the itching becomes hard to manage, and anti-itch medications are often ineffective. For patients, enduring the relentless itch all day long is a significant challenge, severely affecting both their mental and physical health. We've now explored the 10 early warning signs of kidney failure, from minor changes in urine, feelings of fatigue, to shortness of breath or persistent itching. Each of these signs, no matter how small, can be an important indicator of your health, especially when it comes to kidney function. Recognizing these symptoms early on not only helps protect your health, but can also prevent kidney failure from worsening and may even help you avoid serious complications. If you notice one or more of these signs, don't hesitate to consult a doctor for a checkup. Kidney function is crucial for overall health, and detecting kidney issues early provides more treatment options and can greatly improve your quality of life. So, have you experienced any of the 10 warning signs of kidney failure that we discussed? If so, feel free to share your thoughts with us in the comments below, and remember to listen to your body to protect your health in the best way possible.